I want you to picture a loud restaurant. You're with people you love, glasses clink, music is humming in the background, and someone launches into a funny story. Everyone laughs at the punchline, and you laugh too, a second late, because you're hoping you caught it. But inside, there's that sinking thought: what did they actually say? Did I miss something again? That moment used to happen to me more times than I wanted to admit. And for a long time, I told myself it was just part of life. The room was noisy. People were talking too fast. I was tired. The acoustics were terrible. But here's the twist. What I thought was a small annoyance was actually a clue. And it turns out that that clue connects straight to brain health and specifically to dementia risk in a way most women are never warned about. Welcome to the Healthy Life Approach podcast. I'm Kristen Beasley. I'm a certified functional medicine, nutrition, and brain health coach, and I spent 25 years working in rehabilitation. These days, I support women in perimenopause and postmenopause with practical, evidence-based ways to protect cognition and stay sharp. I genuinely believe your best brain years can still be ahead of you. Today, we're talking about midlife hearing loss and why a major report in 2024 called it the single biggest potentially modifiable risk for dementia. We'll also get into the menopause connection that almost nobody brings up, what my own testing revealed, how researchers think hearing changes may relate to cognitive decline, what a major study found about hearing aids, and what you can do this week if any of this sounds familiar. Quick and important note before we go any further: I am a health coach, not a licensed medical professional. This episode is for education only. If you are experiencing symptoms, talk with your healthcare provider or an audiologist to get individualized care. I want to start with my story because I didn't see this coming, and maybe you'll recognize yourself in it. For years, I was fine in quiet one-on-one conversations, but put me in a group setting, and it was like everyone was speaking a language I almost understood. Family gatherings, meetings, restaurants, and even small group conversations, I could catch pieces, but not the whole thread. And like so many women, I had explanations ready in my back pocket. It's loud in here. People mumble. I'm exhausted. This room echoes. I'd brush it off as normal. So I did what a lot of people do. I compensated. I watched faces intensely. I read body language. I filled in the blanks with context. And if you've ever done that, you know the truth. It's not just listening, it's working. Constantly. Your brain is working overtime in every conversation. The moment I couldn't ignore it happened in a professional setting where I needed to track details accurately. No captions, no leaning on context, no room for guessing. And that's when it hit me. I wasn't hearing most of what was being said. I was hearing maybe half and stitching the rest together with educated guesses. The irony is, hearing loss wasn't new to me as a concept. I worked in rehab for decades. I've supported deaf and hard of hearing communities. I've seen what happens when hearing changes go unaddressed: the isolation, the frustration, the way people start avoiding social situations, and yes, the cognitive strain. And still, when it came to me, I tried to explain it away. If you're listening and thinking, okay, what counts as an early sign? Here are a few that came up for me, and they're common: needing people to repeat themselves, especially in noisy places, losing the thread in group conversations, missing jokes and responding a beat late, feeling wiped out after social events, turning the TV up louder than everyone else wants, thinking people are mumbling, nodding along even when you're not totally sure what you've just agreed to. If any of that feels a little too familiar, you're not broken, you're not alone, and you're not imagining it. My turning point came in a pretty unexpected way. I was preparing resources for a client, and I came across information on something called Central Auditory Processing Disorder, or CAPD. And I stopped because the description felt uncomfortably accurate: difficulty understanding speech in noisy environments, feeling like words get scrambled even when your ears technically pick up sound. I realized I couldn't keep guessing. I needed real data. So I scheduled a comprehensive hearing evaluation, not a quick screen, not a booth test, and a handshake. I mean, a full workup with hours of testing, including measures of how you understand speech in challenging environments. Now, here's a simple way to explain CAPD if it's new to you. Sometimes the ears can detect sound just fine, but the brain struggles to sort and interpret it, especially when there's competing noise. It's like the signal arrives, but the brain can't organize it fast enough. Imagine you're in a cafe. Your friend is right in front of you. You can hear the general sound of voices and dishes, and you know they're speaking, but the message doesn't land cleanly. You miss your name. You lose parts of sentences. You have to piece it together after the fact. When the audiologist reviewed my results, he said a sentence I'll never forget. He told me that in background noise, my left ear was picking up only about 8% of speech. 8%, not 80. For context, people with typical hearing often score above 80% on standardized speech and noise tests. So when he said 8, it was like a floor shifted. The evaluation also showed two major pieces of the puzzle. First, I had a clear drop in high frequency hearing, and high frequencies are where so many consonants live, those crisp speech sounds that help you tell the difference between words. When those fade, speech starts sounding blurry. That's where everyone is mumbling feeling comes from. Second, the testing suggested that my auditory processing wasn't as strong as it should be in multiple areas. Now, in my case, the high frequency loss made it harder to confirm a totally separate CAPD diagnosis because hearing loss itself can drag down processing scores. But the takeaway was clear. Both the hearing and processing sides needed attention. I'm going to be honest with you. I grieved. I was in my mid 50s, stepping into a new season, leaving a long career, building a business focused on brain health, and now I was being told that one of my sensory systems wasn't working the way I thought it was. And then another feeling kicked in, determination, because one word kept coming up in the research, modifiable, meaning this is not just fate. This is something you can act on. Now, let's talk about what surprised me even more than my test results. The menopause and hearing connection we barely talk about. When I started digging into the research, the shock wasn't that it exists. The shock was that almost no one mentions it in everyday conversations about perimenopause and menopause. There are estrogen receptors in the structure of the inner ear and throughout the auditory system. Estrogen influences blood flow and inner ear function and even how the brain filters and prioritizes sound. So when estrogen starts fluctuating in perimenopause and then drops in menopause, those systems can become less stable. That can show up as tinnitus, ringing, or buzzing for some women for the first time, or it can make existing tinnitus worse. Some clinicians estimate that a significant portion of women experience new or worsening tinnitus during menopause. Balance changes can show up too, dizziness, a sense of being off, and some research suggests menopause may accelerate age-related hearing changes and interestingly may show up earlier on the left side. That detail got my attention because that was my experience. And it made me ask the same thing you might be thinking right now. Why wasn't I warned? We hear plenty about hot flashes and sleep changes, but hearing changes, vertigo, and sensitivity to sound are often missing from the what to expect list. Now, a quick note on hormone therapy and hearing. The evidence is mixed. There are studies pointing in different directions. Some findings suggest possible improvement in tinnitus for some women, and other large-scale data suggest long-term hormone therapy use may be associated with a higher risk of hearing loss. This isn't a simple yes or no topic, and it's exactly why hormone decisions should be made with your physician using your personal risks and benefits. Now, if you're connecting the dots as you listen, this is a good moment to subscribe so you don't miss future episodes. And if there is a woman in your life who keeps saying, everyone's mumbling, please consider sharing this with her. Sometimes we need a nudge to take symptoms seriously. Okay, let's zoom out and talk about the big headline, hearing loss and dementia. The 2024 Lancet Commission identified untreated midlife hearing loss as the single largest potentially modifiable risk factor for dementia. I want to be careful here. A strong association doesn't mean hearing loss causes dementia in a simple, one-step way. Human brains and human lives are more complex than that. But the relationship is strong enough and the potential upside of treating hearing loss is big enough that experts are urging earlier identification and treatment. You may have heard a number connected to this report. Up to 45% of dementia cases could theoretically be prevented or delayed if a set of modifiable risk factors were addressed worldwide. That's a population estimate, not a personal prediction. Your individual risk depends on many factors, but it tells us something important. There's meaningful room for prevention and delay, and hearing sits near the top of the list. Researchers often describe 3 pathways that may link hearing loss to cognitive decline, and these pathways overlap. First is cognitive load. When hearing becomes harder, your brain starts spending extra energy decoding sound. Imagine trying to follow a conversation in a language you only partially know. You can do it, but it takes effort. If your brain constantly has to work to simply understand speech, that mental bandwidth is pulled away from memory, focus, planning, and learning. Second is brain change over time. The brain is efficient. Circuits that get used stay strong. Input that drops off can lead to changes. With less clear auditory stimulation, the regions involved in sound processing and the networks tied to memory and comprehension may change over time. Some studies have linked untreated hearing loss to faster brain shrinkage in regions associated with sound and memory. That's not meant to scare you, it's meant to underline this. Treating hearing loss is not vanity, and it's not just convenience, it's brain care. Third is social isolation. This one is sneaky because when listening becomes exhausting, socializing starts to feel like a task. You miss the joke, you mishear the story, you ask for the repeat and feel embarrassed. So you go out less, you talk less, you disengage, even if you're sitting right there at the table. And social isolation on its own is associated with an increased dementia risk. Research has shown that higher social engagement is linked with lower dementia risk. Hearing loss can quietly push people from connection, and then you get a double hit. Less stimulation plus less community. Now, for the hopeful part, each of these pathways can be influenced, not perfectly, not overnight, but meaningfully by addressing hearing loss and staying engaged with life. So, what happens when people treat hearing loss? This is where a major study comes in. The Achieve trial, published in 2023 in the Lancet, was the first large randomized controlled trial designed to test whether hearing intervention could slow cognitive decline. When researchers examined the entire study population, they didn't find a significant overall difference. But when they examined a subgroup of participants already at a higher risk of cognitive decline, the results were striking. The group using hearing aids showed nearly 50% slower cognitive decline over 3 years. We absolutely need more research, but that finding is a big deal because it suggests that for people already at a high-risk track, treating hearing loss may help protect cognition. Now, I want to make this practical because at some point you're thinking, okay, but what is it like to actually wear hearing aids? What changes? What doesn't? I decided to get hearing aids, and I chose a pair of Starkey Genesis right here, based on my audiologist's recommendation. I don't have a financial relationship with any hearing aid company. There are multiple reputable brands, and the right fit depends on your hearing profile, your lifestyle, and solid guidance from an audiologist. And I noticed changes faster than I expected. Conversations felt less like a decoding game, less like I was assembling meaning from scraps. I remember leaving a dinner party and realizing something simple but huge. I still had energy. I wasn't mentally toasted from spending the entire evening trying to keep up. I wasn't just surviving a social event, I was participating in it. But I need to say this clearly, hearing aids are not magic. Your brain has to relearn how to hear. If you've been missing certain frequencies for years, your brain adapted to that quieter, blurrier input. When you suddenly give it access to those sounds again, it needs time to recalibrate. That's why audiologists often recommend wearing hearing aids consistently, many hours a day, so the brain gets steady input and can rebuild its filtering skills. And here's something people don't always realize. It's not only about hearing voices. Your auditory system needs a stream of sound to stay active. The little sounds count too. Birds outside, the hum of the refrigerator, footsteps. The full soundscape helps keep those pathways engaged. Many people find the first couple of weeks are the most challenging, and meaningful improvement often shows up in the first month. Full adjustment can take months, sometimes up to 6. That timeline matters because it helps you stick with it instead of assuming it didn't work. And let's address the emotional piece a lot of us carry, the fear of looking old. I felt that. I get that. But I'm telling you what actually ages us: straining, withdrawing, saying, "What?" all the time, sitting in a room full of people and feeling alone. Staying connected is what keeps us vibrant. Also, hearing aids today are far more discreet than most people assume. And with newer AI-enabled technology, the goal isn't to make everything louder. It's to make what you want to hear clearer. These devices can analyze the environment, help separate speech from noise, and reduce the mental effort it takes to follow a conversation. Last year, I went to a conference in a setting with notoriously difficult acoustics, big rooms, echo, lots of side conversations. In the past, that kind of environment almost guaranteed I'd feel isolated and exhausted by the end of the day. This time, I could engage, not perfectly, because I still used good strategies like choosing my seat, making eye contact, and asking clarifying questions. But the experience shifted from barely tolerable to workable. And that's the real goal, not perfection, connection. So, what can you do this week with all of this? First, if you're in perimenopause or postmenopause and you've noticed ringing, sound sensitivity, dizziness, balance issues, or I do fine one on one but struggle in groups feeling, please don't gaslight yourself. Hormonal shifts may be part of the picture and it deserves attention. Second, remember this phrase hearing help is brain health. Untreated hearing loss is strongly linked with the risk of cognitive decline. That doesn't mean panic. It means this is worth taking seriously sooner than most of us have been taught to. Third, schedule a comprehensive hearing evaluation with an audiologist, especially if you've been brushing off symptoms. And here's a key tip. Ask specifically about speech and noise testing. A lot can look fine in a quiet booth, but fall apart in real-world listening environments. Fourth, if you already have hearing aids but aren't wearing them consistently, know that the adjustment can be uncomfortable at first. Consistency helps your brain adapt. If they're truly not working for you, talk to your audiologist. Sometimes settings need refinement, and sometimes newer technology can make a huge difference compared to what you tried years ago. Fifth, if you're worried about someone you love, lead with compassion. Offer to go with them, offer to help them schedule the appointment. Hearing loss can carry stigma, and people often avoid addressing it because it feels like admitting something painful. And on the prevention side, protect your ears from loud noise, use hearing protection when needed, and consider regular hearing checks as you move through midlife. I want to close with this. My diagnosis felt like a loss at first, but it also gave me something powerful, clarity and options. It reminded me that our health isn't only about what runs in the family, it's also about what we notice, what we choose to investigate, and what we're willing to address, especially in perimenopause and menopause, when the body can start sending signals that nobody prepared us for. If my story helps even one woman stop brushing off symptoms, get tested earlier, or feel less alone, then it's worth sharing. Next week, we're talking about supplements and brain health because it's the one question I get the most, and there is so much marketing noise. We will focus on the brain habits that matter even more than supplements, and many of them don't cost a thing. If you want to share your experience or reach out, you can find me on Instagram at Kristen J. Beasley or connect through my website. And if someone you care about needs this conversation, please share this episode with them. Take care of your beautiful brain. Disclaimer, this podcast is for general educational purposes only. It is not medical advice and does not replace diagnosis or treatment from a qualified health professional. Always consult your physician or licensed provider about medical concerns and before starting any supplements, protocol, or lifestyle changes. This podcast does not establish a health coach-client relationship. Individual results may vary. This episode and associated materials may include affiliate links, which may provide a small commission at no additional cost to you.